guys, welcome back to my channel. It's Tamisha Tony of the Radiant RN, and today we're going to be discussing all things travel nursing. Consider this your 101 course. So for starters, what exactly is a travel nurse? A travel nurse is a licensed nurse who is not committed to working at just one hospital. They're typically employed via a third-party agency for a temporary contract, anywhere between 4 to 13 weeks. And once that assignment is complete, you're a free agent and able to move on, or you can request to stay at the same facility. How does one become a travel nurse? So to become a travel nurse, you have to be an experienced nurse. Typically, agencies will ask for 1 to 2 years of experience. I suggest maybe a little closer to 2, just so that you have a lot of time to build your foundation. You want to have good critical thinking skills, good clinical skills, time management, and really know what you're doing. Like you need to have your foundation down pat before you move on to travel. I wouldn't suggest rushing to travel just so that you can make money if you're still unsure of yourself when you're doing your patient care. I'm looking down at my notes because I be forgetting stuff, okay? Anyway, after you have your good foundation, you feel confident in your skills, then you go ahead and apply to the travel nurse agencies. There's plenty of agencies to choose from, so choose wisely. Some are known to be better than others. Pay fluctuates between them as well. I would suggest you working for a few different agencies, like build a profile with different companies. That way you can compare and contrast and do what's best for you. The agencies, typically, they're always going to try to do what's best for them, so make sure that you do what's best for you. Agencies that I personally have worked with, I know are ProLink Healthcare, AMN Healthcare. I've never worked with this company, but a lot of my coworkers have, called Aya Healthcare, AYA. It used to be called Emerald Health Services. They've changed their name now to Epic Travel Staffing. They were a pretty good company for me as well. Building a profile. So to work for all these agencies, you're going to be requested to build a profile. So that essentially is like a portfolio of your resume. You want your resume to stand out. There's a million nurses applying to be travel nurses. So make sure your resume stands out. Take your time with it. Make it stand out from the crowd. And then you're going to need, of course, your nursing license. It needs to be up to date, not expired. And then all your certifications. That can be your BLS, ACLS, PALS if you work with pediatrics. I know for labor and delivery or OB, they have special certifications, as well as any critical care ICU. If you need anything special for those, you'll need all your certifications. So I suggest you have all your paperwork gathered somewhere in a concise area, because you'll be asked to either upload them via a portal that agency uses, or you can email them over, which is what I usually do. If that's not an option, they might ask you to fax some things, but typically everything is done virtually via the internet. Along with that, you'll be required to do a healthcare visit. Typically, the agency will set you up. You give them your zip code, and they'll send you to a doctor's office or clinic in your area to get all of this done. And you shouldn't be paying for it out of pocket. The agency should be covering it. So it consists of a physical. You'll need a doctor to clear you and say that you're able to physically work. You will need a drug screen and blood work. It's typically your titers, MMR, vaccinations. Also, if it's the flu season, they'll ask for a flu shot vaccine. What else? They might ask for booster shots. TB. They're always going to want for a TB. Will either use the quantiferon, or they'll do like a PPD test. And that's usually it, I think. And then after you do all of like the medical stuff, you'll be required to do some exams. The exams are typically run under Relias, or I think it's called Prophecy, is the company that runs the exams. They'll ask you to do your specialty exam. So if you're working critical care, you'll take that test. If you're doing med surg, you'll take that. If you work PCU, you'll do that. ED, labor and delivery, whatever your specialty is, you'll be required to take a competency exam in that area, as well as a medication test. You might have to do a simple math quiz. And then if you work with telemetry, you will be required to do an EKG exam. Those can be a little bit challenging, so make sure you just have like a skills book and freshen up on your skills, because it's different when you're doing something at work every day and then you have to sit down and take an exam. And don't worry, if you're not good at test taking, they typically allow you to take the exam twice. So So if you don't pass on the first time, you can freshen up on your skills and get it right the second time around. And finally, references. They'll typically ask you to start off with 2 references to build your profile. So you want to see if you could get some strong references from a nurse manager or supervisor. If that's not possible, you can always go to a charge nurse possibly, but you'll need at least 2. Now that that's all done, you've built your profile, now you start picking where you want to work. Like I said before, you have a lot of freedom as a travel nurse to pick where you want to work. If there's just a city you've been itching to go to or a state you've been wanting to see, if you're trying to get closer to some friends or family, if you're in a relationship, whatever your desire is behind why you're traveling, go ahead and just pull up different jobs and look at their rates and do your comparisons so you can pick what's the best for you. One thing of note, I just want to let you guys know, make sure that you're asking for guaranteed hours in your contract. That means that even if the hospital or the facility decides to say they don't need you for a particular day or night and they'll cancel you is what it's called, you'll still get paid. So that way, if you're on a 36-hour or 48-hour contract, whichever you decide, you'll get paid for that whole time unless you choose to call out. Then that's the only time you wouldn't be getting paid. You can also be local. To work local as a travel nurse, I believe the requirement is to be under 50, or some agencies will say 60 miles. So if you're like only 20 miles or 25 miles or 30 miles away from the facility, they will consider that a local contract and you will not get paid a stipend. So with that, we lead into the pay. So travel nurses are paid hourly, just like any other worker. You're paid for your time, so you get your hourly pay rate. But what makes travel nurses different is that you get paid an additional stipend on top of that if you meet that 50 or 60 mile requirement. So with that being said, the stipend is tax-free, but it's under the guise that you are duplicating your expenses. So wherever you live, if you're a homeowner and you're paying a mortgage, or if you're renting, you're paying rent at your tax home, you will be asked to you are expected to duplicate that expense, meaning that you're going to be paying for a hotel or Airbnb or a short-term rental, whatever you pick. If the IRS chooses to audit you, you would have to, show proof of that. I've never gotten audited, thankfully, but it does happen. So just be mindful that you're duplicating your expenses when you're on your travel assignment if you are receiving a tax-free stipend. I'm not a tax professional. If you need more help or advice about that, I advise you to go seek a professional tax advisor. Travel nurses, it is a sacrifice. You're away from your home, your family, loved ones. You might be missing special occasions or events. And that's another part of the reason why it can be really challenging and why you'll get paid more. Time off. So you have the freedom to choose how you want to build your contract. And if you want time off, I would suggest requesting it before you even sign the contract. That way it'll be built into your contract. If you know you have a vacation coming up, or if you have a family trip coming up, request those dates off so they can be secured for you. If you know you're someone who doesn't want to work holidays, request that off in your contract. Also, I know some people choose to take summer or winter off to travel. Typically what I've done is in between an assignment, if I'm feeling burnt out, I might take a month off in between before I sign up for another assignment. I will just note that there is typically what we call a 1-year rule for travel nursing. That means if you're continuously working at the same place for beyond a year, you will be required to take time off of at least 30 days, or else they'll consider you a resident of that state and you will no longer get paid as a travel nurse. And then it's time to pick your housing. Once you figured out where you're going to go, you want to do your research. Make sure you're staying in a safe area. You can use a hotel, Airbnb, or a site called Furnish Finder that I personally like. There are also Facebook groups such as the Gypsy Nurse that offer people on Facebook who are sharing and reposting housing options that might be comfortable for you. Just remember your why with travel nursing. Are you doing this to explore? Are you an adrenaline junkie? Or do you just want to see the world? Are you just doing this to make more money? And if so, there's nothing wrong with that. But just know your why, and that will help you have a more enjoyable experience as you're travel nursing. Please be sure to check out my other videos. If you have any questions about anything I discussed today, please feel free to leave them in the comments down below. I would love to answer, and give me a like or a thumbs up, subscribe, share, whatever you want to do. But thank you for viewing my channel. Bye. See you in the next one.